Imagine taking a pill you've trusted for years, something your doctor prescribed, something millions of seniors take every single day, and then discovering it might be quietly putting extra strain on your heart. Not a rare drug, not an experimental one. A common medication found in homes around the world. Today I'm going to share what a heart surgeon wants every senior to know, because this information could literally protect your heart. As a heart surgeon with decades in the operating room once explained, some of the most dangerous threats to the aging heart don't arrive suddenly. They don't feel dramatic. They build slowly, silently, over years. And one of the most overlooked contributors is a very common class of drugs that many seniors take without a second thought. Let me be clear from the start. This is not about fear, and it's not about telling you to stop any medication. It's about awareness. Because when you understand what's happening inside your body, you can have smarter conversations with your doctor and make safer choices for your heart. The heart is incredibly resilient, but it's also sensitive, especially as we age. By the time we reach our 60s or 70s, our blood vessels are naturally stiffer. Our kidneys don't filter as efficiently, and our heart muscle works harder to pump blood through the body. That means anything that affects fluid balance, blood pressure, or inflammation can have a much bigger impact than it did when we were younger. The drug this heart surgeon warns about is often taken for pain and inflammation. It's commonly used for arthritis, joint pain, back pain, headaches, and general aches that become more frequent with age. Many people assume it's safe because it's been around for decades, and in some cases, it's even available over the counter. But here's what most people aren't told. This drug can quietly raise blood pressure, increase fluid retention, and interfere with how the kidneys regulate blood flow, of which place extra stress on the heart. In the operating room, heart surgeons don't just see blocked arteries. They see the long-term consequences of years of small, repeated stress on the cardiovascular system. They see hearts that are enlarged because they've been forced to pump against higher pressure. They see weakened heart muscles struggling to keep up. When they look at patient histories, a pattern often appears. Long-term use of certain pain-relieving drugs is frequently part of that pattern. One of the biggest problems is how these drugs affect blood vessels. They work by blocking enzymes involved in inflammation, which is why they reduce pain. But those same enzymes also play a role in keeping blood vessels flexible and maintaining healthy blood flow. When they're blocked repeatedly over time, blood vessels can become less responsive, leading to increased resistance. The heart has to push harder to move blood through the body. For a younger person with a strong cardiovascular system, this extra workload might not cause immediate harm. But for seniors, whose hearts are already working harder due to age-related changes, it can slowly tip the balance from compensation to strain. Another concern is fluid retention. These drugs can cause the body to hold on to sodium and water. That may not sound serious at first, but extra fluid increases blood volume. More blood volume means more pressure inside blood vessels. More pressure means the heart must work harder with every single beat. Over time, that constant extra effort can contribute to high blood pressure, swelling in the legs and ankles, shortness of breath, and in some cases, worsening heart failure. Heart surgeons often say that heart failure doesn't usually happen overnight. It develops gradually, as the heart is asked to do just a little more than it can handle, day after day, year after year. And medications that increase fluid retention can quietly accelerate that process. There's also the issue of kidney function. The heart and kidneys are deeply connected. When kidney function is affected, even slightly, it can disrupt the delicate balance of fluids, electrolytes, and blood pressure in the body. These pain medications can reduce blood flow to the kidneys, especially in older adults. That reduction may be subtle, but over time it can lead to worsening kidney function, which then feeds back into higher blood pressure and greater stress on the heart. What makes this especially concerning is that many seniors take these drugs daily, sometimes for years, without realizing the potential cardiovascular impact. They may notice higher blood pressure readings and assume it's just part of aging. They may experience swelling or fatigue and chalk it up to getting older. Meanwhile, the heart is quietly absorbing the burden. The heart surgeon who raised this warning shared that many of his patients were shocked when they learned that a medication they believed was harmless could be contributing to their heart problems. These were not reckless people. They followed medical advice. They did what they thought was right. The issue wasn't misuse, it was lack of information. And here's another layer that is important to understand. The risk, isn't the same for everyone. Factors like existing heart disease, high blood pressure, diabetes, kidney issues, and even dehydration can dramatically increase how strongly these drugs affect the heart. Seniors are more likely to have one or more of these conditions, which compounds the risk. That's why the surgeon emphasizes individualized care. Medication that's relatively safe for short-term use in one person can be harmful when taken long-term by someone else with underlying vulnerabilities. Now, this doesn't mean pain should be ignored. Chronic pain has its own serious health consequences, including stress, poor sleep, reduced mobility, and even increased heart risk. The goal is balance relieving pain without silently damaging the heart. This is where informed choices matter. Many seniors are never told to reassess long-term pain medications as their health changes. What made sense at 55 may not be the safest option at 70. And unless someone speaks up, the prescription often continues unchanged. Heart surgeons tend to think long-term. They see how small decisions accumulate over decades. That perspective is what makes this warning so important. It's not about blaming doctors or patients. It's about recognizing that the aging body responds differently, and medications must be reevaluated through that lens. If you or someone you love is taking a common pain-relieving drug regularly, the surgeon's advice is simple but powerful. Don't panic, but don't ignore it either. Pay attention to changes in blood pressure, swelling, breathing, and energy levels. These can be early signs that the heart is under strain. Just as importantly, start a conversation. Ask your doctor whether this medication is still the best choice for you. Ask if there are safer alternatives, lower doses, or non-drug approaches that could reduce pain without increasing cardiovascular risk. In the next part, I'll explain exactly which specific drugs heart surgeons are most concerned about, why they're so commonly used among seniors, and what science-backed alternatives may be safer for protecting your heart while still managing pain. When heart surgeons talk about this issue more openly, they usually point to a group of medications known as non-steroidal anti-inflammatory drugs, often called NSAIDs. These include very familiar names that many seniors recognize immediately, medications commonly used for arthritis, muscle pain, joint stiffness, and everyday aches. Some require a prescription. Others are sold over the counter, which is part of why they're often underestimated. Because these drugs are so accessible, many people assume they're gentle or low risk. But accessibility doesn't always mean safety, especially when taken frequently or long-term. Surgeons emphasize that the heart doesn't distinguish between a prescription label and an over-the-counter one. What matters is how the drug affects blood pressure, blood vessels, kidneys, and fluid balance. One major concern is how these medications can subtly raise blood pressure over time. Even a small increase, just a few points, may not feel noticeable. But research has shown that consistent, slightly elevated blood pressure significantly increases the risk of heart attack, stroke, and heart failure in older adults. The heart has to push against that higher pressure with every beat, day and night, without rest. Another issue surgeons frequently see is the impact on people already taking heart medications. Many seniors are prescribed drugs to control blood pressure, protect the heart, or manage fluid levels. IDs can interfere with how these heart medications work, reducing their effectiveness. In some cases, the heart medication is doing its job, but the pain drug is quietly working against it. This can create a confusing situation where a patient's blood pressure seems harder to control. Even though they're doing everything right, the missing piece, often overlooked, is the daily pain reliever. Heart surgeons also point out that these drugs can increase the risk of irregular heart rhythms in vulnerable individuals. When fluid and electrolytes shift, even slightly, it can affect the electrical system of the heart. For someone with an aging or already stressed heart, that disruption can increase the risk of dangerous rhythm problems. What makes this especially tricky is that symptoms often appear gradually: little more fatigue, slight swelling around the ankles by evening, shortness of breath when climbing stairs that used to feel easy. These signs are commonly dismissed as normal aging, when in reality they may be early warnings that the heart is under extra pressure. Surgeons often say that if pain medications came with a visible warning, something you could feel, immediately people would be more cautious. But because the effects are silent and cumulative, many seniors don't connect the dots until a serious heart issue appears. The science behind this concern is well established. Large studies have linked long-term NSAID use to increased risks of heart attack, stroke, and worsening heart failure, especially in older adults. The risk increases with higher doses and longer use, but even moderate use can be problematic for seniors with existing cardiovascular conditions. This doesn't mean these drugs are bad in all situations. Short-term use, under medical supervision, can be helpful and appropriate. The danger lies in long-term routine use without regular reassessment. So what are heart surgeons encouraging instead? First, they urge seniors to stop self-managing chronic pain without medical guidance. Taking a pain reliever daily because it helps ice and tea the same as having a plan. Pain is a signal, not just an inconvenience, and managing it safely requires looking at the whole body, not just the joints. Second, they recommend reviewing all medications regularly, especially after age 60. This includes over-the-counter drugs, supplements, and herbal remedies. Many patients are surprised to learn that their doctor didn't realize they were taking a daily pain reliever, simply because no one asked and no one mentioned it. Third, surgeons highlight the value of non-drug approaches whenever possible. Gentle movement, physical therapy, strength training, weight management, proper footwear, and targeted exercises can dramatically reduce joint pain and stiffness. These approaches don't strain the heart, and, in many cases, they actually strengthen it. For some seniors, safer medication alternatives may exist. Certain pain relievers that don't affect inflammation the same way may be less stressful on the heart when used correctly. But even these should be discussed with a healthcare provider because every body is different. Heart surgeons stress that protecting the heart doesn't mean living in pain. It means choosing strategies that relieve pain without creating hidden cardiovascular damage. There is also an emotional side to this warning that surgeons don't always talk about publicly. Many of them feel frustrated when they see preventable heart damage. They know that if patients had been better informed earlier, some surgeries might never have been necessary. That frustration is what drives them to speak out. One surgeon put it simply, "I can repair arteries, replace valves, and support failing hearts, but I can undo years of silent strain caused by something that could have been adjusted." The first step heart surgeons recommend is awareness without alarm. If you're taking a pain-relieving drug regularly, the goal is not to stop suddenly on your own. Sudden changes can cause rebound pain, inflammation, or other complications. Instead, the safest and smartest move is to pause and evaluate. Start by paying attention to your body in a new way. Notice patterns. Do your ankles swell more in the evening? Does your blood pressure run higher than it used to, even with medication? Do you feel more short of breath doing simple tasks? These details matter because they help your doctor see the full picture of how your heart may be responding. When you speak with your doctor, heart surgeons suggest asking very specific questions. Ask whether the pain medication you're taking can affect blood pressure, kidneys, or fluid retention. Ask if your age or existing conditions change, how safe that medication is for you now. And ask whether your heart medications and pain medications could be working against each other. These conversations are powerful because many doctors are focused on treating the condition they see most often: joint pain, arthritis, inflammation, and less prompted to reassess through a heart health lens. When you bring up cardiovascular concerns, it encourages a more balanced decision. Another key step is dosage review. Many seniors stay on the same dose for years simply because it was never revisited. But aging bodies process medications differently. Lower doses, less frequent use, or switching to as needed instead of daily use can sometimes dramatically reduce heart strain while still controlling pain. Heart surgeons also emphasize hydration. Dehydration increases the stress these drugs place on the kidneys and heart. Seniors are especially vulnerable to dehydration, which can magnify cardiovascular side effects. Drinking enough water may seem simple, but it plays a crucial role in protecting heart and kidney function. Movement is another underestimated tool. Pain often leads to less activity, which weakens muscles and joints, creating more pain cycle that's hard to break. Gentle, consistent movement improves circulation, reduces stiffness, and supports heart health at the same time. Even short daily walks or chair-based exercises can make a meaningful difference. Weight management also comes up frequently in these discussions. Extra body weight increases joint pain and forces the heart to work harder. Even modest weight loss can reduce pain and lower blood pressure, decreasing the need for frequent pain medication. Sleep quality matters too. Poor sleep increases inflammation and pain sensitivity, which often leads people to rely more heavily on pain drugs. Improving sleep routines, consistent bedtimes, reduce screen use. Proper pillows and mattresses can reduce pain naturally and support heart health. Heart surgeons also remind seniors not to overlook alternative therapies that are supported by evidence when used correctly. Physical therapy, heat and cold therapy, targeted stretching, and supervised strength training can reduce pain without adding cardiovascular risk. These approaches often take more patience than a pill, but they don't silently strain the heart. What's important to understand is that heart protection is not about one single decision. It's about small adjustments that add up. Lower dose here, a movement habit there, better informed conversation with your doctor. Over time, these changes can significantly reduce the hidden stress placed on the heart. The surgeon's warning ultimately comes from a place of prevention. By the time someone reaches the operating table, the damage is already done. But long before that moment, there are opportunities to protect the heart quietly and effectively. Many seniors who make these changes report not only better heart numbers, but also better overall energy, improved mobility, and a greater sense of control over their health. They realize that aging doesn't mean accepting silent risks. It means becoming more informed and intentional. The heart is remarkably strong, even later in life, when it's supported instead of overburdened. And sometimes protecting it starts with questioning the most familiar things we take every day. As we wrap this up, the most important thing to remember is this. The biggest risks to the heart are often not dramatic or obvious. They're quiet, familiar, routine, a pill taken for comfort, a habit formed over years, something that feels harmless because it's common. The warning from heart surgeons is not meant to scare seniors or take away relief from pain. It's meant to shine a light on something that too many people were never told to question. Aging hearts deserve extra protection, and that protection often begins with awareness. Pain matters. Comfort matters. Quality of life matters. But so does the long-term health of your heart. The goal is not choosing one over the other. It's finding a smarter balance that respects how the body changes with age. If there's one takeaway, it's this. Never assume that a medication is still the best choice just because it's familiar. The body you have today is not the body you had 20 years ago. Reevaluating medications, even common ones, is a sign of strength and wisdom, not weakness. By paying attention to subtle signs, asking better questions, and working with your doctor as a partner, you can reduce hidden risks and give your heart the support it needs to keep beating strong for years to come. Sometimes, protecting your heart doesn't require a new drug or a major procedure. Sometimes it starts with simply looking twice at what's already in your hand.